This common cotton swab may actually be doing more harm than good to your ears. As many of us grew up believing, Q-tips were the go-to tool for removing earwax. However, that assumption turns out to be incorrect. The core issue lies in the anatomy of the ear canal, which is approximately 1 inch in length. When a swab is inserted, it does not remove wax. It pushes it deeper toward the eardrum. When you pull the Q-tip out and notice wax on it, it feels satisfying, almost like a job well done. But what you cannot see is the greater amount of wax being compacted against your eardrum with every use. Over time, this displaced wax begins to accumulate and harden, forming a dense blockage that presses directly against the eardrum. This buildup interferes with the eardrum's natural function. Under normal conditions, the eardrum vibrates in response to sound, which then triggers the small bones in the middle ear, known as ossicles, to transmit signals to the inner ear. From there, those signals travel to the brain for processing. When impacted wax disrupts this chain, serious consequences can follow. The effects of compacted earwax include gradual hearing loss, tinnitus, which presents as persistent ringing in the ears, and vertigo, the sensation of dizziness that many people experience without understanding its cause. What is particularly surprising is that the warning is printed right on the Q-tip's packaging, yet most people never read it. The label clearly states that the swab should not be inserted into the ear canal, as doing so can cause injury. If used around the ears at all, it should only be stroked gently along the outer surface. This disclaimer is not minor fine print. It is a genuine medical caution. Ignoring it can result in a perforated eardrum, painful infections, and long-term hearing complications. What are Q-tips actually designed for? The packaging lists a wide range of appropriate uses: applying or removing makeup, cleaning small grooves and crevices, maintaining electronics, arts and craft projects, caring for musical instruments, baby skincare, cleaning between the toes or the navel, and applying topical ointments to the skin. Ear canal cleaning is not among them. This brings up the most important question: how should you clean your ears? The answer is straightforward. Your body handles it naturally. The ear is self-cleaning by design. To support this process, the most effective method is a warm shower. Allow warm, soapy water to gently enter the ear canal. Hold the position briefly, then tilt your head and let it drain. Repeat on the other side. The warm water softens and emulsifies the wax, encouraging it to migrate outward on its own. You may have noticed earwax sitting at the outer edge of your ear after a hot shower. That is your body doing exactly what it was designed to do. Simply use a finger wrapped in a clean towel to gently wipe it away. Nothing more is needed. Clean only the outer surface. Avoid inserting anything into the canal, and you'll be protecting your long-term hearing health. If ear discomfort or pain persists, consult your physician. I'm Dr. Thomas William. Take care of your ears and make it a great day.